Good afternoon, everyone. I'm Joy, a community pharmacist in Watsons. Welcome to Watsons Facebook Live, Ask Our Pharmacist. Imagine now it's 2 a.m. and you're wide awake. You have been tossing and turning since midnight, yet you could not sleep. But still, you have an important meeting tomorrow. So what should you do? So this brings us to the topic of discussions today, insomnia. This is a topic voted upon by you when we released a poll on Watsons' Facebook page last Sunday. If you have any questions along the way, do feel free to leave them as comments. Insomnia is a common sleep disorder in Singapore with a local rate about 15.3%, and a more recent local data found that 13.7% of elderly were reported to experience insomnia. So what is insomnia? Insomnia is a sleep disorder presented by one of the following symptoms: difficult to fall asleep, difficult to maintain sleep, and wake up too early and not able to return sleep again. So all these symptoms impair your daytime function as well as quality of life. So why is sleep important? It's believed that our body and brain need to rest so that they can repair themselves. Sleeping is very important for learning and keeping memories. So if you think about it, we usually spend 1/3 of our time sleeping. So if you do not have enough sleep, immediate effect is you will feel tired, very hard to focus, moody, and your performance drops. And it also affect your safety if you are driving or operating machinery. So in long run, insomnia can actually lead to higher risk of health problems such as obesity, high blood pressure, as well as anxiety, depressions. And insomnia can also increase your risk of substance abuse. Insomnia can be caused by a wide range of factors. For example, pain or discomfort due to certain medical conditions, other sleep disorder, for example, sleep apnea or restless leg syndromes, stress related to big life events such as job loss and the death of the loved ones, environmental factors such as noise, light and temperature, changes to your sleep schedule, for example, jet lag and shift work. Just last week, a customer just shared with me that her daughter is experiencing insomnia because she's going back to school now, switch from home-based learning. So other causes of insomnia are use of medications that has stimulant effect. For example, medications for cold, caffeine, tobacco and alcohol use. Last but not least, mental health issues such as depressions and anxiety. In fact, these mental health problems is the most common cause of chronic insomnia. So how do we manage insomnia? First of all, it's very important to identify the cause of the insomnia. Say if the insomnia is caused by stress, try to look into the factor causing the stress and try to manage it. Or at least accept the temporary insomnia due to big life events. By the way, just a couple weeks ago, my colleague he shared on stress management on Watson's Facebook Live. So for those who missed it, do feel free to watch the video. It's important to identify the cause of insomnia because insomnia can be worsened by pain or any other medical conditions. So in this case, insomnia is unlikely to improve without a proper management of the medical conditions. Practicing sleep hygiene is a good first step for everyone with insomnia. Changing certain habit or behavior may be all you need to improve your sleep instead of taking medications. So here are some sleep hygiene tips. Keep a regular sleep schedule. Go to the bed at the same time every night and wake up at the same time every morning. Do not use phone or read e-books before sleep because the blue light emitted from all these electronics can actually reduce the secretions of melatonin, which is a sleep hormone required to help you sleep. Secondly, the content may excite you and make you harder to fall asleep. Avoid caffeinated drinks or food and avoid smoking in the afternoon. They are stimulants and can keep you awake. Avoid alcohol at bedtime. Alcohol may appear to help you sleep, but it actually wakes you up middle of the night and it also impairs the quality of your sleep. Do not exercise 3 to 4 hours before bed because it can make you harder to fall asleep. Do not go to bed too hungry or too full. Adjust the bedroom environment so that it's quiet, cool and dark. Lastly, put all the worries aside and tell yourself you will deal with them tomorrow. There's also another behavioral technique, is what we call stimulus control, whereby it just train our brain to use the bed just for sleep. No TV, no reading, no eating on the bed. And you only go to bed when you are sleepy. You have to get out of bed if you couldn't sleep in 20 minutes or when you start to feel anxious. In some cases, practicing sleep hygiene are not enough. The doctor will prescribe medications with the objective to address the daytime function impairment as well as to reduce the anxiety before falling asleep. So the medications prescribed by doctor usually is for short-term use, meaning 2 to 4 weeks, and to be taken when necessary. So short-term use and to be taken when necessary are important because we want to reduce a case is what we call dependence. In other words, to prevent rebound insomnia when you stop taking the medications. Secondly, we want to reduce tolerance, which is a situation you actually need a higher dose to achieve the same sedative effect. One of the commonly prescribed medications is called benzodiazepine. It's reduce the time to fall asleep, reduce the nighttime awakening, as well as increase the total sleep time. Another class of medication is Z drugs. Example from this drug is zolpidem and zopiclone. So you probably know why it's called Z drugs, because they all start with Z. So it works similar to benzodiazepine, just that it works more specifically. Same as benzodiazepine, it also carry the risk of dependence, so it should be taken when necessary. Antihistamine diphenhydramine has been used for to treat insomnia as well, but it's particularly not good for elderly because it carries many side effects. And routine use is also not recommended because the tolerance can develop as soon as 1 week. Then antidepressant is also it's not to be used for insomnia, but it is a good option if the person also has anxiety or depressions. So most people do not seek medical advice when dealing with insomnia. They often choose to self-treat with over-the-counter supplements. You probably have heard of melatonin or valerian, which are one of the most popular supplements for insomnia. Most studies show that both valerian and melatonin slightly reduce the time to fall asleep, and patients reported improved sleep quality. As melatonin is a hormone released in the brain to regulate our sleep-wake cycle, it may be helpful for elderly when melatonin secretions is decreased. Although it might be worth trying for some people, but do not take longer than 4 weeks due to lack of safety data. There are reports that rebound insomnia occur when valerian is stopped. Before taking any supplements, always check with your doctor and pharmacist because they could have potential interactions with medications as well as medical conditions. For example, if valerian may increase the concentrations of some medications in the body if they are taken together. On top of that, taking supplements together or with prescriptions medications may also cause excessive sedations. For all the drugs and supplements that I mentioned earlier on, it may cause carryover drowsiness for the next day. So avoid driving or engage in activities that require complete mental alertness the day after taking the melatonin, the day after taking the medications or supplements, until you know how much you actually will respond to them. More importantly, do not take them together with alcohol because it may cause excessive drowsiness. To sum up, sleep hygiene is the mainstay of the management of insomnia. If sleep problem persists for more than 1 month, or if they interfere with how you feel as well as your daytime functions, do seek medical help. I hope you enjoy my sharing. Now I would like to save the last few minutes to address some questions. Okay, I have a question from Wendy here. She's asking whether it's safe to take melatonin up to 1 month. Okay, short-term use of supplements, for example, valerian, melatonin, GABA, may is supposed to be safe for most people. Yes, but the long-term safety data is lacking. So in terms of the exact durations, for melatonin study, it shows that it's safe to be taken up to 8 mg per day, up to 6 months. But the most importantly is we have to look into why do you need to take a supplement for such a long durations. Do remember, if your insomnia actually persists for more than 1 month, you should seek professional help instead of relying on the medications. And on top of that, sleep hygiene is the mainstay of the management of insomnia. Okay, I have another questions from Serene. Is asking whether power nap is good. Okay, a regular sleep cycle actually consists of 4 stages, as well as a deep sleep phase, is what we call REM phase. So power nap is actually a short nap that do not enter into deep sleep phase, mainly stays in stage 1 and stage 2. So study has shows that power nap helps to rejuvenate you, and also help to improve your memory as well as attentions, as well in other words, it give you the energy to complete the task for the rest of the day. However, nap should be tailored to individual. So people with insomnia, especially those on stimulus control therapy, should avoid taking nap in order to consolidate the nighttime sleep. So I'll take the last question from Colin. Are the supplements good for jet lag also? Yes, one of the popular supplements for jet lag as well as insomnia is melatonin. So melatonin 3 mg can be taken for those that will experience jet lag on the day upon arrival, as well up to 5 days after reaching the place. So I see, okay, here we are at the end of the sections. If you have more questions, do feel free to leave them as comments. I'll be here in the next 3 hours to address your queries. I hope you have enjoyed these sections and wish all of you a good night's sleep.